On behalf of the Center for Child and Family Policy at Duke University, I'd like to welcome you to this School Research Partnership event called Addressing Child Poverty During the Pandemic. The School Research Partnership is a program designed to help Duke researchers effectively collaborate with schools and community agencies. And my name is Leslie Babinski, and I'm the director of the Center for Child and Family Policy. Thank you so much for joining us today for this important discussion and how the pandemic has been affecting children and families, and to consider our path going forward. We're so fortunate to have two very impressive leaders speaking with us today about child poverty. I'm pleased to introduce Lisa Gennetian, Pritzker Associate Professor of Early Learning Policy Studies in the Sanford School of Public Policy. Welcome, Lisa.
Thank you.
And David Reese, President and CEO of the Durham Children's Initiative. Given their expertise throughout this discussion, we'll be considering the impact of the pandemic on child poverty, both in our local community, as well as from a national perspective, and the potential impacts of the American Rescue Plan. Lisa is an applied economist whose research focuses on issues related to child poverty, ranging from income, security, and stability to early care and education, with a particular lens toward identifying causal impacts of child poverty on children's development. And David has led the Durham Children's Initiative through incredible growth since he joined the organization as its first and only president and CEO in 2010. The mission of Durham Children's Initiative is to create a pipeline of high quality services from birth through college or career for children, youth, and families living in Durham. Today, we're also showcasing the research of our graduating seniors who we're so proud of in the Child Policy Research Certificate Program. And following the discussion with David and Lisa, please join one of our breakout rooms to hear about our students' work. And as we begin our discussion with David and Lisa, I invite you to send your questions for our speakers through the chat function, and we'll be getting to those as we can through the discussion. So welcome everyone again, and thank you for joining us. I'd like to start by asking you, David, can you please give us an overview of the Durham Children's Initiative and just tell us, what has the past year been like for you? What does child poverty look like in the Durham community this year?
Well, Leslie, good afternoon and good to see you. Lisa, good to see you as well. So happy to be here with you. You know, COVID's just been like amazing in so many ways, right? I mean, there's all of the negative effects, and then there's all the things that we actually learned from COVID and how we've learned how to adapt. Back with the Durham Children's Initiative, as you mentioned, our goal is to create a pipeline of services that starts at birth, should end at college or career. We bring together high quality interventions and weave them together and create alignment so that we can walk with children and families along this, as I like to think about it, the yellow brick road, right? At the end of the yellow brick road, you have this pot of gold, and that's, post-secondary attainment and, or a career exploration. We've been, I think, I want to make sure I choose these words really carefully, right? COVID's been devastating when we start thinking about the effects on kids and families, in particular, kids and families who we already knew were struggling with with the effects of poverty. We're talking about working poor families who were working every single day, and they were a step ahead. And then the pandemic happens, our economy shuts down for a bit, and it's almost as if someone pulled the floor from underneath folks. These are so many of the conversations that I've been able to have just with parents. And what's also so interesting about this, as we think about, the pandemic, child poverty, is we think our young people don't know, right? You think that young people are back in a home, and, parents do their absolute best to sort of protect young people from their children from all of the hardships that the pandemic has brought and created within households. But what we found was that our kids that we work with, they were fully aware of the changes and the shifts. And as you can imagine, that just creates a whole host of other concerns as we really think about the social emotional effects that's just on children as they navigate through the pandemic, really then also putting a name to poverty and recognizing that we're getting emergency food now. We've never gotten or had to receive emergency food before. Something's very different in my household.
Thank you so much, David. So Lisa, I'd like to invite you into this now. As an economist who studies child poverty, I know that you've been following the national impact of the pandemic on children and families. Does that description that David just provided in the Durham community look similar to the national data that you're looking at? And what has been the national impact on children and families from the pandemic?
Thanks so much, Leslie. Great to be here with you, David. This is like round two. We tried to do this last year, so great to have this actually happening this year.
Yeah.
So at the short answer to your question, Leslie, is absolutely right. The microcosm of what DCI is experiencing here in Durham is happening in a macro sense to many children across this country. So I think it's useful to step back for a second and just ask ourselves, so where was child poverty and rates of child poverty before this pandemic? Because the story is actually, it was pretty good news, right? We were sliding towards reductions in trends in poverty. If you look at something called the supplemental poverty measure, so this is something that considers the income benefits available from safety net and other programs and adjusts for cost of living, we were seeing reductions of poverty, right? It was as high as almost 30% in the late 1960s to 16% in 2016, right? And this trend was just continue to go downward all the way through 2019, to the point where a group was convened by the National Academy of Sciences with the charge to reduce child poverty even further by half. That's how optimistic everyone was thinking in terms of tackling child poverty in the US. And then the pandemic hit. And I completely agree with David, and I think it's going to be a theme today. The pandemic has revealed so much about the strengths and weaknesses of our infrastructure and what we have available to protect children and families. So here are three things that I wanted to mention with the context of we were actually moving towards a pretty good place, right? Before the pandemic hit. So one is parental job and income loss. So what David said is absolutely happening across the board in the country. And I've got a nice child evidence brief posted at the Society for Research in Child Development that tries to summarize that literature for those who would like to see more of that. This is important because earnings continues to be a huge portion of income, reliable income for families. So job loss and income loss is a very big hit. If we look at monthly poverty rates, which is kind of can give us the dynamic picture of what's happening, we can see that there was an increase by 6 percentage points in child poverty from April to August 2020. So then the stimulus package kind of hit and went back, child poverty rates went back to pre-pandemic levels, which was optimistic, but we weren't in a world with zero child poverty. So I just want to remind people of that. And now we're seeing an uptick again. So I think it's going to be a big question about whether we continue to stabilize at the rates that were existing pre-pandemic. The second is racial and ethnic disparities, right? So the optimistic picture I offered is not the same picture for every child in the US. Child poverty rates for Black and Latinx children have always been higher. They're persistently higher. And that's due to a variety of factors that we are also learning more about, right, through this pandemic. And some of that is most certainly structural factors related to systemic inequality and systemic racism. And then there's the third thing that I want to say as the ingredient in this recipe for disaster or maybe support, if you want to be optimistic, is how the social safety net is designed in the US. So one dynamic that's happened in the last 20 years or so is much more of our social safety net is structured and hinges on work. So when you have a pandemic like this that not only affects the public health environment, but also the economy and the way it has, you are unraveling the way that the social safety net was initially designed to come in and protect children. And so that's where we're seeing things like what David was talking about, why people and institutions like him have had to step in to help with food, right? Our safety net is not designed to do that kind of work in this kind of economic recession, right? Where it's just happening in broad numbers and happening in a way because the public health, confounded with public health, has some real restrictions, right? In allowing people to go back to work. So I'll pause there.
All right, thank you, Lisa. Thanks for outlining those three broad areas. That was really helpful to think about it in that way. So David, let's go back to you and talking about what's happening in Durham. So either, reflecting on what some of Lisa just said there, but also moving on to thinking and telling us about some local strategies that DCI and other organizations are using to address child poverty?
Right. You know, I think the first strategy that immediately came to mind for us organizationally was, let's just ask the question, what do you need? And so we embarked on 2 surveys. The first was really, that last week in March, almost a year ago, right? The last week in March, which was then asking, so how are you doing? And the answers and responses were, I think, fairly encouraging. We came back and we followed up with the second survey about 4 weeks later, and there was a dramatic change in the response, right? And this is really interesting. So 7 and 9 of the respondents said they needed emergency financial support. 9 and 10 of the respondents said they needed emergency food support. So as you can imagine, this is where the community begins to mobilize. And this was really, especially from a DCI perspective, of creating infrastructure that then allows our community to be able to respond back to the needs of families connected back to DCI, and also in the adjacent East Durham section of our city. This really involved bringing in food rescue organizations. This involved bringing in, community partnerships, philanthropic partners, bringing philanthropic partners together and allowing them to be able to ask the question, what do you need and who needs what? And then think about, well, how do they, and with their financial support, begin to support efforts to just address basic needs. Now, this is really interesting as well, because we're talking about folks, for the most part, working poor. This was our experience. People got up every single morning and went to work. And all of a sudden, work, as Lisa talked about, was gone, non-existent. And now it was just poor. And the other challenge, I think, for our community was we weren't built or designed to support just folks without jobs, without an on-ramp somewhere else. And so that, I think, also was a challenge for our community. But our community is resilient. And what we found was Durham Public Schools was absolutely amazing in thinking about how to address food insecurity within their segment and cohorts of young people that they worked with. There were pop-ups in terms of food distribution sites where families could come get food. And then we started getting really creative, understanding the need for families to have some level of autonomy and control within all of the spiraling out of control that COVID created, which we were able to give gift cards along with emergency food. Gift cards, folks say, yes, the gift cards allow families to actually go into the store and buy what wasn't given to you at a distribution site. I mean, this could be the toiletries, this could actually be the pack of meat. This could be this could be anything else that you and your family might need to sort of make it through to the next week. The funny story, but it's also, I think, a heart-wrenching story is this is the popsicle sticks that were able to be purchased so that young people back within households could have some sense of normalcy, right? It felt like the world is crashing down around them, but at least we can have some popsicle sticks, using the gift cards to do that, as parents also try to just hold their families and their loved ones together. Overall, I think the broader strategy really has been thinking about addressing really basic needs as a whole. And then on the flip side, really thinking and recognizing that adolescents were going to get in the game. They weren't going to just sit on the sidelines and watch their families flounder. They were going to figure out, well, how do I support mom, dad, grandma back at home? And as you can imagine, then that creates tension when we start talking about adolescents, older adolescents, also then attending school. And this is amazing, right? In Durham, 21st century, we're having to make a determination between work and school. But this was the challenge of COVID-19.
Wow, David, thank you so much for sharing all of that. I appreciated how you started with asking people what it is they need. so important, and restoring that sense of normalcy. Like, it's interesting to hear you think about the psychological needs of families for autonomy and control, in addition to their basic needs. So, Lisa, let's turn to you now. Could you tell us about the national strategies being implemented to address child poverty? And in particular, what components of the American Rescue Plan do you think have the potential to reduce the impacts of poverty on children and families?
Yeah, thank you. I'm tempted to be a little cynical that there was no plan until the American Rescue Plan. So I'm actually going to say that and be quite honest, that children have been really under the radar of a concerted national policy. And it's really the good work of organizations like the one that David is leading that really keeps a really sharp lens on children. So thank you again, David. The other thing I want to say is I love this "what do you need" question. So and let me just comment on that. So the census has done something remarkable. They've been able to quickly marshal resources and mount a large survey data collection effort, right, within weeks. It's called the Census Pulse data. It's available. It's really easy to find. And this is their way of kind of tracking kind of the hardships and problems that people in America are experiencing over the pandemic. Wouldn't it have been amazing if they had included that simple question, what do you need, as part of Census Pulse, right? Rather than this presumption, we know what you need. You need food. We know you need food, right? It would just really change the frame of how we think about public policy and supporting families, and also our judgment about their ability and capacity and their intentions. Everyone wants to do good for their children. So let me pivot to ARP for a second, the American Rescue Plan. This has been sort of a path-breaking set of legislation. It includes many components that scholars who've been studying poverty and child poverty for decades are very, very excited about, because again, we haven't seen this kind of national attention in the way that the Biden administration is bringing to the table right now. So there are many components that are designed to help build infrastructure in the way that David just talked about. So supporting housing, supporting food, very important, supporting school reopenings, right? Getting the pandemic under control, including resources to make sure vaccines are getting out equitably. So that is all part of the plan. The part of the plan that is especially exciting for people like me who really study the income component of poverty reduction, like what would happen, David, if we took those gift cards, amp them up by a couple of $1,000s and send them to families, right? Would it hand out money to people who are income poor? So ARP includes an expanded child tax credit that is essentially mimicking that kind of design. So that child tax credit will give up to $3,600 for each child under the age of 6, and up to $3,000 for each child age 7 to 17. It's an expanded child tax credit. It is in the amounts that we know from evidence and from what's in place in other countries like Canada and the United Kingdom, that it has shown to be very supportive to family life and children's development. So that is a really exciting component of ARP. Now they say it's going to go out monthly. There's some question about how effective that means. So it might be just a big lump sum payment that families get in early 2022. So one other thing that I think is important, I think we're going to get back to this as we keep our conversation, is this is a 1 year, right? 1 year temporary kind of set piece of legislation. And so understanding how it's going to work and using whatever evidence we have about that will be really important in potentially like continuing this type of support at a national level.
Thanks so much, Lisa. And thanks for unpacking some of what seems to be kind of a complicated national strategy outlook. It's so interesting to hear you talk about it and how it fits, historically with what we've provided to support children and families. I really appreciate that. So David, now turning back to you, how do you think these components of the American Rescue Plan may or may not impact the families that you work with?
Sure. So I have a question first. Hey, Lisa, since we did the gift cards here in Durham, I mean, like, we take credit for like the whole premise and concept of being able to give money back to families?
Oh, I I wish I could say that, but David, I'm involved in a big study where we're basically giving cash to families on debit cards too. That's been in
Just
process
take
for a while.
credit. There we
We
go.
can talk about that. I'm a big fan of the debit gift card idea. Yeah.
So, Leslie, to get to your question, I think it's complicated because, for some families, this is going to be a lifeline. This is going to be game changing. This is going to relieve so much stress. This is going to bring families back to a place where they were before. For other families, what we have to acknowledge and just be very honest with ourselves is they didn't receive the first time stimulus. If you were undocumented, you didn't receive stimulus. That was just, as you can imagine, devastating to families. The other, as we talk about stimulus 2 and stimulus 3, in terms of the rescue plan, if you didn't file your taxes for whatever the reason, you're out of luck. And this is, sort of the cart before the horse, right? And which comes first? I'm trying to maintain my housing, but I need to take money to file my taxes to actually get to a place where I then can be eligible for a stimulus program. That sounds so simple when you have the money readily in your hand. There was an eviction moratorium, and President Biden extended it. Our governor has, felt very strongly about it and created some guides around that. That only applied to sort of on the radar housing. So when we come back to this whole large segment, especially within North Carolina, of families who have any level of documentation concern, those rules and laws really just don't apply. And so for us as an organization, what we've known is that we've seen a lot of evictions, so much so that we actually had a donor go ahead and set aside a fund for us to be able to support families with back rent. And a private donor in doing this, just because our own numbers, as we're a small nonprofit in Durham, we're in North Carolina, we're large in Durham, but in North Carolina, we're a small nonprofit, but this was a huge need for us. And I think it only gets magnified back within other communities with similar demographics. So I think it's very complicated. I don't think it's straightforward. But for those families that are eligible, I think this is tremendous. I think you really can begin doing some of the math and thinking about, well, if you have 3 children, if you have 4 children, what kind of a boost does that create? For some families, especially as our economy begins to open up and more sectors begin to, I think, continue to hire, it actually puts families in sometimes almost in a place, a step ahead of where they were pre-pandemic. They actually move from a week to week, paycheck to paycheck to I'm 2 paychecks away, or maybe 3 paychecks away, just because of the infusion of support. So the easy answer or the hard answer is, I think this is complicated. I really think we're going to have to see what happens long term as it actually the money comes down to, as we like to say, Main Street.
Yeah, that's so interesting, David. Thanks so much for explaining that to us and the potential, lifeline, as you said earlier, for families, but also a reminder about the families who are outside of the system and the resources and the supports. It's really an important thing to consider. So Lisa, when you think about the implementation of the American Rescue Plan, what are some concerns that you have about its rollout, and what do you think needs to happen for this truly to have the impact that it has the potential to do?
Yeah, I want to echo some themes that David brought up. I think implementation is absolutely the big gorilla in the room. And so one thing is context. So there were actually 2 proposals around this idea of a child allowance. One of the proposals, which is what ended up getting passed, was to expand the child tax credit, right? And there were 3 parts of that. So every child gets a bigger amount of money. It is refundable. So the refundable is a really important component. So you don't need a tax liability, meaning some earnings, and still get this credit. And it also expanded the age group of children. There was another plan that didn't make it through, right? The Romney plan. And the Romney plan had lots of other wrinkles, but one key difference was that this money, a monthly benefit, would go through the Social Security system. And, I think there are real implications there for implementation. You quibble about the rest of the design, but the implementation component of this, that's a key difference in those systems, is the Social Security system is completely used to distributing money on a monthly basis, right? They know how to do it. They know how to do it well. Has nothing to do with the IRS or any documentation that you need with the IRS, or whether you're familiar with filing taxes at all in prior times. So it completely uncouples some of those barriers you might think about with the tax system from actually getting the benefit. So that's neither here nor there, but I'm just putting it out there that the plan through the SSA system was part of the Romney plan. And if we're back to revisiting what might happen in the future, I can imagine that conversation might come up again. And there's another aspect about monthly that very much relates to what David talked about with the lifeline. Stable, predictable monthly income just puts less kind of planning demands, right? Versus having a big lump sum payment that you are waiting to get. Maybe you'll get, maybe you won't get, right? That all is very demanding and juggling, while you're living on a shoestring, literally, never mind paycheck to paycheck. And then, so related to the IRS, I just echo what David said. The IRS is not a system that's been friendly to everyone. And certainly the friendliness is further and further away for the low-income working poor families that we're thinking about that could benefit the most from this program, right? It requires some familiarity, documentation, Social Security numbers, ITN numbers, all of that stuff. The other thing that I just want to also throw out there as we think about implementation is that, it's not going to address, going back to this issues of inequities in our country. And that has certainly been a really disconcerting kind of reality for many people through this pandemic. And certainly we're reckoning with it. But the question is, are we doing something about it, right? We're still relying on our old systems because that's what is available to us, and we should absolutely do that. But, can we push our systems to also address all those inequities? I worry a little bit about that. I worry about the same children being left behind, even under this very generous plan.
Very well said.
Yeah. Absolutely. That idea of, I think I've heard a lot of conversation around this, are we going back to normal? Are we going back to where we were before, or are we going somewhere new? So David, let me turn to you with that. So much has changed in the past year in ways that, well, many of us could never have predicted. I want you to think ahead to next year. Where do you think we'll be this time next year in terms of supporting children and families in the Durham community, and what needs to happen to get to at least your ideal picture of where we could be?
I get to be Swami for at least like 4 minutes, right? 3 minutes. I've been thinking about that question. I think that's really, that's so difficult. I remember when we first started reacting and responding to the pandemic. I remember at DCI, we were trying to think 3 weeks ahead. And we soon realized, after several failed attempts, that thinking 3 weeks ahead was unfruitful and we were just failing miserably. And so then we started just pushing that goalpost further and further away. So we were thinking like quarterly, right? Because at some point in time, COVID would end and our world would go back to normal. Well, here we are 13 months later, and we're still in the midst of it all. Couple things, I think a couple of areas of concern for me in terms of what needs to happen, and I'll try to frame it that way. We really need to be paying attention to the new segments of our economy which have grown, which are now employing essential workers. Those essential workers are my moms and my dads. Those are my grandparents and my uncles who are just, working to make sure that they create a safe, stable environment for the young people that are here in Durham and part of DCI. For the first time during the pandemic, I started using delivery services. I didn't use delivery services before, right? And so there are all these different facets of our economy which have grown, and which our parents, I say our parents have begun to think about as they supplement their work schedules. Because what we also know is that they're not back at a lot of families are not back at full 40 hours a week. They're not getting overtime. They're at work, but just enough work to kind of keep them going. And they're taking on other roles, other second and third jobs to sort of make ends meet, if we start thinking about it in that way. The economy recovers. What happens to those jobs as we go back to what becomes our normal? As more and more of our community becomes vaccinated, and we start going back to the way that we were living before, do those jobs go away? And then what's the effect back on those essential workers? And so what I think needs to happen is that we need to really have a comprehensive plan, a transition plan back to a sense of normalcy, also recognizing that normalcy or normal cannot be the normal of before, but it really has to be a hybrid. And how do we then also think about how we protect our workers? Because when we're protecting our workers, we're also protecting our economy. When we're protecting our workers and our economy, we're actually protecting our young people.
Yeah, a lot to think about there. Thank you so much, David. That was so interesting. So Lisa, how about you? What's your prediction for the future? If you can think ahead to a year from now, or maybe beyond that, what do you think will or could happen?
Yeah, so I'm a glass half full kind of person. It's a weakness and a strength, I'll confess. So here, are some, especially for someone studying child poverty and the intersection with racism, it can be very trying. So here are some maybe notes of optimism. I actually don't want the normal. I think we need to be in a new normal, and I think this is a moment where we can jumpstart a new equilibrium. And I think it's really important for us to stop talking about normal. Normal was not very good. And so let's just see this as an opportunity to reset, to reboot, to redo, and undo, right? Many of the things that just kept, again, lots of children behind and interfered with opportunity that every child deserves. I know that the child poverty and the poverty scholarship community is already preparing for the arguments for why the child tax credit or something equivalent to that should stay in place. So that's good news. We'll see politically what will happen, but in terms of scholarship, that's already actively in place. I mentioned this before. I don't think we can solve racism, by the drop of a dime, but I think it is very much part of our conversation. And that's something to keep harnessing, because part conversation and reckoning and acknowledgement, I think, is a strong stepping stone to real change. And I hope that change will happen very quickly. David, I think the other rose-colored glasses approach here is the way that communities can really step up and accompany and supplement kind of top-down policy response. We've seen some amazing, going back to resilience and response, kind of what's been happening, faith-based communities, community-based organizations, the resources they were able to harness through this pandemic. Is there components of that we just make permanent, right? So it's not like federal, state government, and then no one else. It's really about a holistic approach that's both grassroots community as well as federal support. So I hope that will have a new kind of set of recipe that kind of it remains in place moving forward. The last thing I want to say, and I am embarrassed that I didn't say this before David mentioned this, but it's really important to acknowledge that the loss in employment that's been happening has been differentially affected by women. So there's been a just astronomical departure from the labor force that we've never seen before among women. And that's going to have some really strong implications. The employment and earnings through women has been really key. So how do we think about that? And that cannot happen without us thinking about childcare, right? How are we building a really strong early care and childcare system so that we can support work? Work means earnings. Earnings means tax revenue for the government. Tax revenue means reinvestment in public infrastructure. This is a really wonderful virtuous cycle. And so investment and reinvestment, I think, in the early care and childcare workforce, as well as those kinds of settings, including those provided by DCI. I'm optimistic that we will see more momentum around that. Now, don't call me in 2 years to reevaluate, because that might be a very difficult thing for me to do.
No, I'm expecting to invite you both back in a year and replay this and say, how did it go? This time last year, of course, we couldn't have predicted. So
right.
You brought up so many really important points, and I know we've just kind of touched the surface of all you have to say about them, but certainly addressing inequities is kind of an underlying or top of mind, I guess we would say, structural issue that really needs to be part of our new normal. So I appreciate you bringing that up and thinking about the interconnectivity of all the different things that you've mentioned, employment and workforce and housing and schooling and childcare availability and childcare workers, and it's all interrelated. So I want to invite our audience. David and Lisa could speak about any of these topics for the next hour, but which of these do you want to hear about? Which of these are related to your area of work that you'd like to hear more about? We do have a question from the audience right now, though, on a specific issue, and that is vaccination rates in our communities. So as we start getting back to being able to mingle socially, let's just say, going to the grocery store, how do we understand lower vaccination rates in some of our communities of color, and how do we approach that to make sure that everyone has access? Either of you want to take that?
Sure. So why don't I start, and then Lisa, I'm going to ask you to come and help when I get started, right?
Okay.
All right. So first, I want to commend Durham. I want to commend our public health department, Rod Jenkins, the folks back at the health center, Duke Health Center, University Health Center, for where we are as a community just regarding our vaccination programs. In particular, where we are within communities of color in terms of access. And, I got an email today, does DCI want to be a site, for potential for vaccinations? And so there have been all of these other locations back within communities, low wealth communities, traditionally communities of color in terms of access. Now, there's another side to that, which is vaccine apprehension. And the vaccine apprehension, we all know that's historical. There's another reality here. I asked this question, I said, so can you tell me what will happen with this vaccine 10 years from now? And the answer to that is we don't know. We do know what it does today. And so I think one of the main strategies right now, as we continue to have these, I think, real conversations back within communities of color, is there is access right now, and let's continue to have the conversations about whether this vaccine is good for you and your family today, and this being a family choice, an individual choice, and if it's not, but let's continue to have the conversation.
So, right. So David, my economics training is going to kick in a little bit, and I welcome you to push back on that thinking, right? I can wear many hats. I mingle with lots of different disciplines. Here's one other take on this. I mean, echoing everything you said. And I guess I also want to put out there that school reopenings is so important. And so in terms of prioritizing vaccines, kind of addressing this question about uptake, I just prioritize it to the teachers, let's get schools open. We absolutely need to do that as soon as possible. And I absolutely agree that one challenge here is trust with the medical system and the medical community. And we've done a really not great job. Speaking for myself, representing research and research scholarship in how we've approached communities of color and people of color and engaging with them from a research perspective. And I can give you lots of even examples of my own work and what we're trying to do to change that ivory tower, white person helicoptering in and kind of exploitation. In some cases, it really happened. And so how do we keep tackling that perception? But here's what's missing from the conversation. I think we have to frame it this way. It's a risk versus benefit. right? Conversation. And I know that gets tricky when we're talking about, well, risks are not equitable and benefits are not equitable. But we know we often talk about like the dangers without talking about, but here is the alternative. And you know, we're in this digital age where information is very confusing, and it's not really being positioned in that way. The few economists that I know that have positioned it that way have been shot down very quickly, right? Like they've been accused of advocating for the wrong side. But you know, how else are we supposed to do this? It will never be a perfect model. You know, vaccines always come with some risks. Even the flu vaccine does. So how can we frame this in a way so that people also understand the benefits and the alternatives? So that would be sort of that's my kind of econ thinking.
Right. I hear that, right? And
Yeah.
I think, you know, there's the risk and benefit. And I think there are a lot of folks who they make that distinction and say it's more risky for me to actually get COVID than for me to take this vaccine.
Right.
But I'll share with you though, you know, when we begin talking about disparities and we begin talking about structural racism in terms of vaccinations, there's this question of, well, do I go get my vaccine in East Durham or do I go get my vaccine in a different neighborhood, in a white neighborhood? Because vaccines
will be different.
Will vaccines be different or not be different?
Yeah.
And I think, as maybe elementary as that sounds, I think that's also then a true reflection of us and our community and our society, right? Because we do the exact same thing with food.
Right.
So when we go to a grocery store in East Durham, a grocery store in East Durham looks very different than a grocery store on 9th Street. And so I think this is why I say we need to continue to have the conversation, right? And because we have to have these conversations, I think both within communities of color, I think also within the broader community. So I think people can ask the questions, get some answers, and then begin to make some decisions, I think, which is best for them and for their families, because, you know, there are so many examples of, oh, that's preposterous. Why would you ever think that? Well, when we look at real life scenarios today, I mean, not all schools are created equal. Schools look very different in East Durham traditionally than they have, you know, in North Durham.
Right. So why would you assume the vaccines won't be different? I mean, everything you've been exposed to so far suggests differences along these lines that you talked about. So you're right. It's like a real dilemma.
Yeah.
Everyone should have the limousine ready vaccine. And the truth is we haven't set up any other system that's limousine ready for everybody. So how do we counter that?
Yeah, those are really interesting analogies you bring up, David, and so true. We have another question from a participant, and this one's about the stimulus checks. Someone is wondering, was the size of the stimulus too small, and did its episodic nature leave families just barely hanging on and simultaneously falling behind when those funds ran out?
Right. So David, curious to hear from you and your families. I guess I'll just comment. So the Trump administration stimulus checks were $600. And the other thing that happened over the course of the Trump administration is extending unemployment benefits. And now we know that lots of people got both of those, but lots of people who were eligible didn't. The Biden administration will have another dose of stimulus checks. Those will be $1,400. And you know, it's a one-time stimulus check. It will not be enough for many of these families living on the margins. So it's not enough. It's not enough. I mean, something is better than nothing, but it's not enough. And you know, there are ongoing debates about, I'm going to throw this one out there because there's certainly some economists who argue this, and I don't sign on to this argument at all, is related to targeting. Like my view is very much get the money out, get it out as quickly as possible. The returns to getting the money out and protecting people's lives and getting the economy open are going to have far higher returns, right, than any debt that's going to be accumulated in the future. That is often countered by the efficiency of targeting, right? But targeting means that you have to put in a bunch of rules. And those roadblocks, we don't have really good understanding about who ultimately gets through all those hoops and who doesn't. And so I guess I'm not very sympathetic to the idea of more targeting, more bureaucracy for the sake of less future debt, because I think history has not suggested that that has worked very well. So David,
I
do you have
agree.
any
I
examples
agree.
of families at
Yes.
DCI that?
So the way I would frame it and ask folks to think about this is, um, you have 3 children, but you've been unemployed in theory for the last last 10 months. And now, but you also, because you're unemployed, you were not able to pay all of your bills, right? Because we know that those folks who are unemployed, they're using basic need structures and infrastructure that we've just recently created back within our community. At some point in time, the rent moratorium is going to go away. The rent that you owe did not go away. And so unfortunately, and this is where I think, we really have to think in a much more comprehensive way about long-term recovery and not necessarily one-offs, because the stimulus will help right now. But when that moratorium goes away and you have a $9,000 rent bill, that stimulus money helped you stay afloat, helped you maintain, helped you catch up to sort of get a step or two ahead. But we know down the road that there's a cliff and we're speeding towards it. And so I agree, Lisa. It's not enough. I think taking on debt now for our future growth is just tremendously important.
Thank you both so much. Another question's come in about what investments that have been made locally should continue after we come out of the pandemic. Are there any changes, David, that you've seen that you really hope will be part of our future?
Sure. It's especially thinking about young people and thinking then also about adolescents. So we've made, DCI has made, and our community and our philanthropic community have really supported adolescents in employment and matching savings accounts, creating opportunities for youth to be part of a COVID solution back within communities, organizations that are then delivering COVID relief. I think we've gotten really creative in that process, right? Because we recognize that our adolescents were going to go to work, whether we wanted them to go to work or not go to work. They were going to feel young and invincible, and they were going to not let their family totally sink. They were going to do everything that they could to help their family stay above water and continue to sort of paddle, right? And do that dog paddle. And so there's been a lot of effort both within the philanthropic community, back at Duke, back at DCI, with other partners, really thinking strategically about how do you actually create employment opportunities for adolescents while supporting their academic pursuits, right? And so actually giving young people teaching them the skill sets of how do you manage school and work? Because for so many of our young people, we cannot have that be the decision that they make, which is one or the other. And because we also know the recovery is long, will be long, we want fewer and fewer of them to have to make that decision. But that investment, I just think has been totally amazing.
I think that's pretty incredible, because I think the other thing we're learning is young people are now struggling with this decision about investing in school.
Yes, they
right?
are.
And it's really troubling, because we know the returns to higher, more and more education are
Yep.
pretty high in terms of your long-term economic security. So like a model, David, that you're talking about that kind of blends this keep in school, but keep working. These are all, again, like the marching steps towards economic security in an environment where school's kind of like a little uncertain, work's a little uncertain. So thank you. I think that's exactly the right way to protect young people who, again, are the future of our country,
They are.
contributing to Social Security and everything else.
Yeah. Well, Lisa and David, thank you so much for engaging in this conversation around where we are and where we're headed. And I really hope we have opportunities to continue this conversation as things play out, since we don't really know what the next year holds for us, and what we all can do both professionally and personally to make sure we're making the best contribution we can. So I really appreciate you joining us for this conversation today.